Good morning. Good morning. Good morning. And again, my name is Dr. Sasha Dorset, and I am so excited this morning to present to you the Rotary Club of Nassau Sunrise on this oh so important topic. It's Alzheimer's disease. So what's next? Alzheimer's disease is a complicated but crucial topic. It is the most common degenerating disease, dementia. It's the most common cause of dementia. And interestingly enough, it is the sixth most common cause of death in the United States. And in a small study that I completed at the geriatric hospital this year, we found that 59% of our inpatients had dementia. And in our public setting, we see about 300 older persons, 300 individuals who are over the age of 65 in an outpatient setting with our public hospitals authority. We've done a prevalence study with that community and found that 31% of that population has dementia. So the numbers are high, and this topic is indeed worthy of discussion. So this opportunity to discuss Alzheimer's disease is amazing, and it's important because people are living longer. And people are living longer with diseases, chronic diseases, not only the hypertension and the diabetes, but they're also living longer with Alzheimer's disease. Today, almost 1 in 10 people are older than 60 years old. And by 2050, we expect that 1 in 5 persons are going to be older than 60 years old. And the Bahamas is not exempt from these increases in numbers. In 1970, 3.7% of our population was considered older. And in 2050, we expect that it's going to be about 10%. In 2020, it was 7.7%. And so we're seeing a steady increase in our older person population. And so with more older persons comes more disease, comes more dementia, and there also comes more caregiver burden for those who have to take care of those patients who are suffering from dementia. So let's talk about how Alzheimer's disease works. It is thought that the brain has proteins. All of our brains have proteins, and they're called amyloid and tau proteins. They surround the brain cells. The amyloid proteins are on the outside, the tau proteins are on the inside. We all have them. However, in patients who have Alzheimer's disease, or they have those unhealthy brains, the amyloid proteins form plaques, and the tau proteins form tangles. So these plaques and tangles cause brain cells to die. And when the brain cells die, the brain shrinks. And that is the beginning of the problems that we see. What's interesting, though, is that these changes can be happening, and no one knows if there's no imaging done. There's no symptoms for up to 10 years. And then, on a micro level in our brain, we have neurons. And these neurons use neurotransmitters or special chemicals to communicate with each other. And so an important neurotransmitter that comes up a lot in discussion about Alzheimer's disease is acetylcholinesterase, right? So this fancy neurotransmitter is how neurons in your brain communicate with each other. So these neurons tell the brain or help the brain to communicate and say, it's time to swallow, it's time to drink water, I have to answer Dr. Stevens when she's talking to me, it's time to walk. This is how the communication happens with the brain. However, the patients who have Alzheimer's disease have lower levels of this chemical, this acetylcholinesterase. There's less of it. So we said earlier, changes can be happening and you don't even know it. And so it's important for us to discuss how these changes slowly occur and recognize the early changes. So for example, the hippocampus, right? It's the center of the brain and it's often affected first. And the hippocampus is vital to forming memories, right? So in the early stages, there is a challenge forming new memories. And these individuals may remember childhood memories, but don't remember what they had for breakfast, right? So they may remember growing up in Georgetown, Exuma, but they can't remember what they just said 2 minutes ago So it's very challenging. They may not remember their grandchild's name. They may not remember their address eventually. And with decreased independence comes challenges with getting dressed, challenges with completing what we call the basic activities of daily living. And unfortunately, more often than not, things get worse and patients present with behavior changes. They get a little bit more aggressive than we would like. They wander, they try to leave their home and go wherever they think is their new home, right? There's also the risk of reduced mobility, increased morbidity, reduced mobility, and so much more. So when discussing Alzheimer's disease, it is important for us to know that every presentation is going to be different, and the way persons present differs due to their culture, their personalities, their socioeconomic statuses, and education. And some of our screening tools takes that into consideration. So as we talk, I think the question that's going to be on our minds is my grandparent, is my parent, am I at risk of developing Alzheimer's disease? And so there are many risk factors. Some we will highlight. A big one is age. The older you are, the greater the risk. Family history is a risk factor. And so there are some special genes associated with the increased risk of development of Alzheimer's disease. A biggie is ApoE protein. And research has shown that several lifestyle changes and conditions are associated. So they aren't a direct cause, but there's an association between Alzheimer's disease and, for example, cardiovascular disease. And so your risk is greater if you smoke, if you're obese, if you have diabetes, if you have high blood pressure, if you have high cholesterol, right? And there are some other not so fast and strict associations that research has found. They include hearing loss, untreated depression, loneliness, being secluded, and living a sedentary lifestyle. So, just wanted to use this next slide to just highlight again that there is a genuine increase when we talk about age. So we see the older you are, the increased risk there is. And interestingly enough as well, women are more at risk than men for developing Alzheimer's disease. We don't know why. We don't know why. All right, so the Center for Disease Control understands where Rotary is coming from and the importance of just having a national plan available to talk about Alzheimer's disease. They have a list of goals. They have a manifest of goals where they talk about the importance of enhancing the focus on risk reduction. That's what we want to do. They want to monitor and improve access to public health, surveillance data. So that screening tool that you have in front of you is something that we want to get out to everybody so we can increase screening. They want to continue clinical trials on the most promising drugs and health promotion exercises. So there is a national or international focus on Alzheimer's disease. And so here's how you reduce the risk. And this is all information that the CDC agrees with. And we know we've heard it before, but it remains true. Prevent and manage your high blood pressure. Manage your blood sugars. Maintain the healthy weight. Be physically active. Quit smoking if you do smoke. Avoid secondhand smoke. Avoid excessive drinking. And get enough rest. I know that last one is hard for a lot of us, so I'll say it again. Get enough rest. Okay, so let's talk about diagnosis. If you are suspicious that you have a family member, neighbor, friend who has signs or symptoms of Alzheimer's disease, ensuring that they are seen by a neurologist or a geriatrician can be very helpful. And so what these physicians do is they look at some of the details and factors that we've already mentioned, and they will ensure, for example, that the imaging work, the MRI, the CT, the PET scan that is done looks at those amyloid plaques and see if they're increasing or if they are abnormal in that patient's brain. Or they'll look at a CT brain and they'll see something that says, Well, the brain is atrophic, meaning the brain has shrunk or the brain is smaller in certain regions. And like we keep saying, it comes out, early detection is best. And early detection means early prognosis. And early prognosis, knowing early that your loved one has Alzheimer's disease, could mean early intervention. And early intervention means, hey, let's stop this disease before it progresses too fast. Let's put some things in place to slow it down a little bit. And so there are some valid screen tools that are available to the public that we can use to just tell us if a patient has Alzheimer's disease. One that we like in our public clinics is the mini mental status exam, but there is also the MOCA screen, and there's also a SAGE screen that you and I could administer to ourselves if we're concerned about changes or memory loss. I like the mini mental status. It is well liked. It is a valid tool that's often used because it looks at different categories or components of mental health or cognitive well-being. So for example, it looks at if you're oriented. Do you know who you are? Do you know who's sitting across from you? Do you know where you are? Do you know what floor of the building you are on? Do you know the date and the time? And I find some of us who don't have any cognitive impairment often don't know the date, right? So that's one that we see that people get wrong just a lot. It looks at how well you recognize items. So do you know that that's a cup? Can you say the word cup, phone, laptop, table? Can you identify objects and say what they are? Another biggie is being able to recall something. So if I said to someone in the room, remember these 3 words, car, bus, table, and then I ask you in 5 minutes for those words, being able to recall car, bus, table in a few minutes can be an indication of whether you have some cognitive impairment or not. And then, like we said, how to utilize language. Can you put a sentence together? That's something that we test. And it could be as simple as, I love you. I am sad, I am happy. So just being able to put a sentence together. And again, those things differ because people have different personalities, people have different educational levels. The results table that's attached to the mini mental status exam is helpful because the scoring system includes and it gives some advice at the very end, and it says, hey, yes, this is it, yay, no. I think there's a chance that you could have Alzheimer's disease, right? So it gives you ranges, and those ranges differ based on education of the client. And I think that's an important thing to consider. So here's the question, can we prevent the disease? The answer today, December 1st, 2022, is no, we can't prevent Alzheimer's disease. And there is no cure yet. There is nothing, no cure in mind yet. But there are treatments and there are tips that we can put in place. Treatments that can improve quality of life and slow progression. So a biggie is memory aids, ensuring that calendars and clocks are surrounding patients, and so they can say, it is December 1st, 2022, it's a Thursday morning, right? So being able to just give that information keeps you oriented. We now have so many fancy electronics. We have Alexa at home, and Alexa can tell us and remind us of, hey, what's the to-do list for today? That's a memory aid, whether we like to think so or not, right? So they keep us accurate on our information, and they are helpful tools. There are drugs that slow the progression of disease. I think you remember us talking about these 2 neurons that have to talk, and they have to say, hey, it's time to eat. Put food in mouth, right? These neurons that communicate. And we said that the chemicals between those neurons are a little bit low. There are some drugs called acetylcholinesterase inhibitors that help to increase the amount of drug between those neurons and improve the communication between the neurons and the brain. And so it doesn't make you better, but it stops the disease from worsening as quickly. And so there are also some vitamins and supplements on sale, on advertisements that are marketed that say, hey, can we use something like Prevagen? I don't know if you've heard of Prevagen. There are commercials on television encouraging us to take these supplements. There are benefits for memory loss, but no clear clinical trial has associated some of these supplements with improvement or treatment for Alzheimer's disease specifically. But I want to say, wait, there's hope. A few hours ago, actually, I saw a post by the New York Post, and they said Alzheimer's disease could be the beginning of the end. And this post is literally 4 hours ago on Flippergram that I saw. And it talked about a new drug. And the drug is a monoclonal antibody called lecanemab. It's brand new, and it's still in trials. And what they're saying this drug is going to do is it's going to go in the brain, and those plaques and tangles that we talked about, it's going to clean up those plaques and tangles, and it's going to restore some brain cells, and your brain will not shrink, and so it will treat, cure Alzheimer's disease. That is the hope of this new drug. It is still in clinical trials, but I thought it interesting that this could be the beginning of the end. So, I just want to say that highlighting those who suffer with Alzheimer's disease is absolutely critical. But we must mention those who provide care for those with the Alzheimer's disease, and those are our caregivers. They are selfless, they are heroic, they are worthy of praise. And just even on a public health level, people who have caregivers have shorter hospital stays, and they're less likely to have to return to hospital for post-acute care. There are proven studies that say this. So it's the personal love, and it is a public health support as well for us as a country. And so I have some information I thought to share with you about the Bahamian caregiver from a study I completed. And so the typical Bahamian caregiver is a single female between the ages of 35 to 54 with a high school education. They live in a household with 3 to 5 people, and they tend to complain of financial burden mostly, then emotional burden, then physical burden. All right, that's what our Bahamian caregiver typically looks like. And so I think there are so many tips that we can share with our caregivers in the Bahamas and around the world, especially those who care for patients with Alzheimer's disease. The first thing we have to say is recognize, know you're stressed. And caregiver stress can look like feeling overwhelmed. It could look like constantly worrying. It could look like feeling tired. It can be getting irritated more quickly than you usually do, getting angry, losing interest in the person you're caring for. All of that is caregiver stress. So it's important to recognize that. And I like to share with patients and their families in clinic, once you recognize this caregiver stress, scream. And what screaming could look like doesn't have to be an audibly loud noise, but screaming means asking that sibling for help. Right? Asking a spouse or a close friend if they could take Grammy for a walk today. Accepting dinner from Sister Susie so that you don't have to cook and look after Aunt Rosie tonight, right? So just creating that balance. Another big thing I think for our caregivers is them accentuating your positives, right? And so that is a twofold meaning. If you know you have specific strengths, you are great at those smoothies that your older person loves. Don't stop making them. But you are not so great at the baths, and your sister is better at the baths, and she has the patience. Let that happen, right? So it's creating that balance. And accentuating the positive could also mean highlighting the good days of a patient with Alzheimer's disease, right? So if they were happy today, they bathed and got dressed, and they were very cooperative, I think that is worth highlighting, praising, encouraging. And we can't forget in the midst of challenges to accentuate the positive. And so also wanted to share the importance of getting connected, right? So getting connected, these are some resources on the screen that can really help you. One that isn't on the screen that I'd like to mention, we have public health clinics, and attached to those clinics, we have a caregiver hotline where information can be readily available from our physicians at the geriatric hospital. information about caring for your loved one with Alzheimer's disease. Another online support group that I like, and I think they have just valid, reliable information, is the Family Caregiving Alliance. And I think it would be remiss of us not to mention that the Bahamas Alzheimer's Association is up and running. Their website is up, they're having events, they are very helpful, they are a support. All right, so, and then my last point, and I think I'm just so happy that you guys have taken this up. You can't be afraid to do a little research, get a little bit more information. Knowledge is power. And so here we are getting a little bit more equipped to deal with the challenges of life. All right, so thank you so much for this opportunity. I hope that something I shared was helpful. Any questions?
I have a comment. Honestly, before today, I really had no idea about Alzheimer's. You know, just something you just saw and you never thought about it. But I never realized, how deep it was. And I want to thank you for your presentation because I've learned a whole lot. And
awesome.
It was an excellent presentation. It was very clear, very concise, and even we could understand it. So I just want to say thank you.
Thank you. We have a question behind you. Yes, ma'am.
I want to know, why does Alzheimer's affect the short-term memory as opposed to the long-term memory?
That's a great question, right? So it affects the short-term memory first. So there's a particular region in the brain called the hippocampus. And for some reason, those amyloid plaques and those proteins, those tangles, they form in the hippocampus. They go for the brain cells in the hippocampus first. And that area of the brain is concerned with our short-term memory. And so sometimes and eventually, if the disease progresses long enough and the patient lives long enough, they will lose their long-term memory as well, unfortunately. So it's just that it goes there first. Yes.
Thank you.
You're welcome.
Are there any questions online? Oh.
Is there any particular advice you would give to caregivers in, dealing with and exercising patience with an Alzheimer's patient or the sufferer who continually repeats the same questions?
Yeah. So I think a big thing is understanding the disease, right? Understanding, firstly, that this patient, this person, this loved one does not remember. I think sometimes as caregivers, it's easy to get overwhelmed and to think, this must be intentional. Like, they have to remember, they asked me this question 10 times today. But if you understand the disease, the brain cells are shrinking, the neurons are unable to communicate with each other, they truly don't remember asking you that question before. So first, let's understand that it's not intentional. Even though this disease is neurocognitive or mental, it is a disease that's beyond their control. So I think that knowledge helps first. And I think it's okay to sometimes switch your answer, all right? And see if you get a different response, or redirect that person or patient to another conversation or activity or task or puzzle, whatever, or a song, all right? And so maybe redirecting that conversation helps them, or helps you and helps them to change the topic, all right? Sure. Oh, sorry.
There's a question online. Melanie, Rotary Melanie, go ahead with your question.
Thank you. Good morning, Doctor. Thank you for your presentation. Is it possible that we could get a summary of your presentation, please?
Sure, I can share that with Dr. Stevens and then share that with you, for sure.
Thank you very much.
You're welcome.
Keep up the good work.
Thank you.
The words Alzheimer's and dementia, are they used interchangeably? If not, what is
the difference, right? So dementia is the overarching category of neurocognitive impairment. It's the big, broad topic, umbrella. Alzheimer's is a smaller subsection of dementia. It's a type of dementia. So we focused in on that today, but there's Lewy body dementia. We see that a lot in our population, unfortunately, because it's associated with ischemic changes. So we get these strokes and the brain cells die, or these cholesterol plaques form in the vessels, and so oxygen and nutrients can't get to the brain and the cells die. That's a biggie in our culture because we have so much high blood pressure, diabetes, strokes. So it's like different types of dementia. Another thing we often confuse too in our country is something called delirium and dementia, right? So dementia is this insidious process characterized by these changes in the brain. But delirium is something acute, fixable, maybe caused by an infection, maybe caused by a drug. We could fix this. And so just encouragement, if you have an older person and these changes happen so fast, I would take them to the doctor immediately because it's more likely delirium than dementia. We wait too long, delirium could become dementia.
Yes, go ahead.
Is there a big support group in the Bahamas?
Yes, we have a Bahamas Alzheimer's Association, and I think that they have recently revamped about 3 years ago. Miss Wendy Poitier is the president.
Okay, so I understand there's a question in the chat. Is there any training for caregivers here in the Bahamas to aid them in better understanding what they can do to assist persons with Alzheimer's?
That's an excellent question. I don't know of any official training programs, but at Sandlands Rehabilitation Center, every year we have a caregiver symposium in October. Just had it, about 200 persons, awesome webinar. If you go to, I think, the Public Hospitals Authority's website, you can see this webinar that was conducted by Dr. Indira Grimes, and it's well done, great information.
So is it sporadic or hereditary? So if you have a family member who has Alzheimer's, should you be concerned?
Having a family member with Alzheimer's is not enough to be concerned. But if you have a genetic test done and it shows that you have, for example, the ApoE gene, then your risk of developing Alzheimer's disease increases. But it doesn't mean that you will. And so taking those lifestyle changes into consideration can help to prevent the onset of this disease or the progression of the disease. So a gene doesn't mean yes. So having one gene could mean yes, your chances increase. I think having 2 ApoE genes increases your chances like 10 times. Still doesn't mean you are going to get Alzheimer's disease.
All right, any other questions for
Yeah,
the doctor?
is Alzheimer's, getting Alzheimer's connected with age?
Yes, it absolutely is connected with age. And so the older you are, the increased risk of developing it. And I think the fact that you could have these symptoms and not know anything about it for 10 years or so, and then hide symptoms for a long time, like you kind of know you're not remembering how to get home the same, but you don't want to stop driving, and you know, so just some changes can happen and you kind of hide it from your family. So sometimes we also think there's a late onset, but sometimes that person, that older person, is aware of those changes is happening in their own mind and body.
Approximately at what age that the youngest person has developed Alzheimer's?
So just I haven't seen any clear studies on that, but I have seen patients in our country in clinic not 60 years old diagnosed with Alzheimer's disease. Yeah. It tends to be our older clients, but I've seen patients not 60, 58, 57. Yeah.
One more question though.
Sure.
Stress, how much is that?
Yeah, so there is research to support that there's an association between stress and Alzheimer's disease. The exact pathology, what happens to the brain because of the stress, isn't known. Now, I know some men in the room might be thinking women is the ones who get stressed out, and, and the women have it more than the men. I don't know. I'm not sure. But so that exact, train is not known. But yes, stress has been associated, found in clients who have Alzheimer's disease, increased stress.
any other questions for Dr. Dorset? If you're online, you have a question, please open your mic. We have just one more question that we can take. All right. I see a lot of comments online, Dr. Dorset, about how excellent your presentation
Awesome.
is. And so I think that may be it for questions.
That's it. Okay.
All right.
Thank you so much for the opportunity. All right.
All right, let me invite Dr. Roteran Rashando to now do the vote of thanks, which you can do online. So go ahead, please. Oh, yeah.
Okay, good morning. Dr. Dorset?
Yes.
Hey. So we want to thank you so much for coming in today and giving us such a wealth of knowledge on Alzheimer's disease. We know about it, but it's not talked about as much. We don't bring much awareness to it. So we thank you so much for coming in and bringing awareness to Alzheimer's disease. We'll definitely use this information. And thank you once again.
All right, thank you guys. And so, like we said, this is Disease Prevention and Treatment Month. We want to put the spotlight on Alzheimer's, and we hope to prepare a small documentary that we will share publicly, perhaps on ZNS and so on. And that's why we had all of this to do this morning, because we think it's important information that the public needs to know. And I just want to add my word of encouragement. Just try to eat right, exercise, and manage your stress. If you got anything from it this morning, manage your stress. Exercise, whatever that means for you. It could be yoga, walking, and eat well. All right, so thank you so much again, Dr. Dorset.